Hi everyone, my name is Delcy. Kyle and I are working together this week to present the topic of feminist technical communication. We've divided the articles and I'm going to present an overview of the article for this week by Novotny and Hutchinson, titled Data Our Bodies Tell Towards Critical Feminist Action in Fertility and Period Tracking Applications. The authors of the article first present an overview of history of feminist issues in technical and professional communication, or TPC. So they mention that Thompson and Smith in 2006 found that the bridging of technical and professional communication with feminisms brought up many issues. And the issues that it brought up were gender bias in texts, recovery of women's contribution in TPC, critiques of representations of women in TPC contexts, and relationship between technology and women's bodies. There's also been a decline in TPC feminist research since the 1990s, and there has been a call for a renewed recognition of ways in which feminisms have, do, and can inform social justice work in TPC. So the authors give some background on infertility in the United States. They mention that 1 in 8 couples in the U.S. will receive an infertility diagnosis in their lifetime. They also mention that only 16 states in the U.S. have mandated full or partial insurance coverage of fertility-related treatments. And 1 round of in vitro fertilization, or IVF, equates to a cost of an average of $20,000. And 2/3 of patients undergo 6 rounds of IVF before giving birth to a living infant. And so that would be a total of $120,000 spent on IVF treatments. So fertility and period tracking applications, they kind of give an overview of what these are. So these applications allow users access to their menstrual health data to increase their reproductive health literacies. They increase autonomy and access to personal health data, thereby reducing barriers to reproductive and fertility care. It's a form of do-it-yourself health technology. Functions as a technical communication by collecting and interpreting personal health data to enhance women's health literacies and agency in healthcare decisions. Widely accessible and affordable, supporting e-health and Health 2.0 trends, and appeal to many as an affordable fertility tool. So Glow, the specific app that they look at in this article, was developed by PayPal founder Max Levchin and former Google exec Mike Hong. It's free to download and use the basic services. They do offer a premium service for $50 a month called Glow First. It markets to couples trying to conceive and guarantees a small payout after 10 months that they can redeem at a local fertility clinic. It advertises that women are 40% more likely to conceive when using Glow as a fertility tracker. It also provides the ability to collect and interpret bodily data from the privacy of one's own home, and communicates via, and allows the users to communicate via forums with other individuals using the application. So it has like a community section in it. Some of the issues with Glow that were identified by the authors of this article include they think that Glow should take more explicit efforts to make clear when and how users give up their data to Glow. They mentioned that consent is hidden and obtained when users download the app. So a lot of time users don't realize that they are consenting to use of data. They fail to make the collection and use of personal data transparent to its users. They maintain ownership of user data, even after the user has terminated their agreement with the app. And then they offer no additional information after giving users their probability of pregnancy for the day. So what that means is the app every day gives the user a probability of pregnancy. So for example, they might say, today you have a medium chance of pregnancy, but they offer no other information. So no explanation about why the user has been assigned to that particular rating for the day. The authors explain in the article the framework that they are going to be using to analyze the app. That's the topic of this article, Glow, which is a period and fertility tracking application. And so they decide to use Frost's feminism methodology to help analyze the app. So Frost in 2016 stated that feminism methodology is useful for building a critical analysis with social justice action in TPC. Frost asserts that technical communication scholars and practitioners need an apparent feminist methodology in order to intervene in situations in which technical documentation unfairly and uncritically engages in oppression while feigning objectivity. Frost recommends that we focus primarily on audiences as a component for best results when we are looking at the concept of efficiency. And so for efficiency to support feminist aims, technical communicators must consider the results that are produced and who those results benefit. So Frost recommends primarily focusing on the audiences of these technical documents and not necessarily on speed and energy if we're looking at efficiency. Solutions that the authors have come up with for GLOW to be able to incorporate more feminist action into their application include GLOW to embrace a more feminist care-based approach to its efficiency and meet proclamations that the app promotes user agency throughout the entire process of user interaction throughout the app, redesign by technical communicators of the terms of service and the privacy practice documents, and revision of GLOW's interface towards a human-centered and culturally attentive design approach. And some of those examples are on page 356 of the article, and I'll go over some of those here in a minute. So in regards to the terms of service and privacy practices, those can be redesigned to be more transparent about gaining user consent and the access of personal health information. So oftentimes these documents are not written in plain language, and so they're not easily understandable by the user. Technical communicators can consider how design and language can help reduce literacy barriers that are embedded into the technical documents obtaining user consent. There is often also a power imbalance between the sellers and the consumers, and so that can be remedied by providing enough information to the consumers so the consumers are able to make informed decisions about using the seller's products or services. In regards to a human-centered design approach, to create that, technical communicators can allow users to engage in a more transparent process of opting in and consenting to the terms of service and the privacy practices. So they can develop a engaging design that supports user engagement throughout its documents. So, for example, requiring active participation on screens that require users to read, comprehend, and fully consent to the app's conditions of use and data collection policies. There are some examples of this, like I mentioned before, on page 356 of the article. Some of those examples include what data is, by providing the user with what data is collected, and using visual examples so it's easier to understand, and how data is collected using those visual examples as well. Also describing where data is stored with specific descriptions, and then what third parties have access to, and then what they do with that data. So options, also including options for opting out of data collection, full right to owning all personal data, and ability to terminate services and taking all data with them upon termination of services. Those are all examples of moving towards a human-centered approach. The culturally attentive design approach can be achieved if technical communicators recognize that women have a right to own data collected from their own bodies. Technical documents can also work to take on a more invitational tone and provide personal contact by phone or in meetings among all stakeholders. So the questions we came up with for discussion regarding this article about GLOW include, does the desire to become pregnant cause women to ignore privacy concerns of health applications? This is discussed on page 355 of the article. if you want some background. Is this an ethical concern that should be addressed? Is it ethical for an application to give users a probability of becoming pregnant based on the data they input? What about user error and lack of appropriate questions to fully assess the person's fertility status? How can health apps empower patients to advocate for their own health care? And what do you think is the future of health apps? Do you think that they will increase in use in the future? How do you think they are helpful, and what problems do you see arising with their use? So we look forward to your answers to these questions and the other questions we've posed about the other articles. And we look forward to interacting with you this week. Thanks.